Okay. Good day, everyone. Good morning, good afternoon, good evening, depending on where you're signing in from. My name is Ifeanyi Sofo. I'm the Director of Policy and Advocacy for Nigeria Health Watch. And I'm joining this meeting today. I'm facilitating the meeting all the way from Abuja, Nigeria's federal capital city. Thank you so much for making time in this webinar. Today, we're going to be talking about protecting healthcare workers, a need for urgent action. So just a bit of some instructions for the Q&A, because at the end of the day, I'm sure that we're going to get lots of questions. So we'll use the Q&A function at the bottom of your screen for questions today. If you have a question during the remarks, please enter it into the Q&A box. For those that are joining in using their phones, you can send your questions via email to press@vitalstrategies.org. Let me repeat again. Joining by phone, you can send your email to press@vitalstrategies.org. My colleague, April Bald, will facilitate the Q&A. We'll make every effort to answer as many questions as we can get to. We also have a French translation of this meeting. And to hear the French, look at the bottom of your screen, an icon there at the bottom right of your screen, named interpretation. If you click on it, you will see the different options. But I think most importantly, you also have an option to mute the version that you're most interested to hear. So we're here because of health workers. COVID-19 has again shown why we must protect health workers. As of September 2020, over 7,000 health workers have died simply because they were trying to protect us from COVID-19. You must all agree with me that this is unacceptable. We cannot have a situation where people who are protecting us would die in the line of duty. Again, this is also not a new problem. So we must leverage the current attention for long-term improvements. And the improvements, to be honest, are not rocket science. So very simple things like improvements in infection prevention and control, training health workers, improving the socio-economic status of health workers, providing legal support to health workers, and generally, continuous monitoring and improvements will make health workers, their patients, and the overall health system safer. And by extension, protecting health workers, ultimately will make us safer and, to face the future as the world begins to recover from COVID-19. So I'm really excited that Resolve to Save Lives and over a dozen partners recently released the report, Protecting Healthcare Workers, a Need for Urgent Action. And this report lays out the problems our health workforce currently face and recommends urgent actions to address them. Today, we're honored that the Federal Ministry of Health of Ethiopia, that is displaying very strong leadership on this matter and has vowed to work to change the status quo at home and abroad, is co-organizing this webinar together with Resolve to Save Lives. And at this point in time, it is my honor and privilege to hand it over to the Director of Human Resource Development, Directorate at Ethiopia Federal Ministry of Health, Asegid Iman Samuel, for his keynote speech. Over to you, Asegid.
Thank you so much, and good morning and good afternoon, everybody. I would like to thank you all for taking part in this very critical and important discussion. As most of you know, we are in a time that we need to double our efforts, to fight the current pandemics and upcoming different kinds of emergencies. So Ethiopia is very pleased, to be organizing this event with Resolve Save Lives, which speaks to an issue of utmost importance for our country, strengthening the health workforce and protecting our healthcare workers. For over 2 decades, Ethiopia has made it a priority to increase the number and skill mix of our health workforce. Our government commitment has been reflected in notable policies and programs related to human resource for health, prime among us, which is our innovative and well-known by the Health Extension Worker Program. So the first cadre of the Health Extension Worker was started in 2004. In the following years, Ethiopia has expanded its programs. Healthcare workers that serve at the community level have been key to our progress towards universal health coverage. But even as we have invested, there are still gaps. We do not have sufficient number of healthcare workers, and we see the COVID-19 pandemic, how quickly progresses can be undone. When COVID-19 struck, the government of Ethiopia exerted tremendous efforts to curb the disease. It limited public gatherings, ordered schools closures, directed hired civil servants to work from home, and closed borders. It declared a 5 month national state of emergency and granted pardon of thousands of prisoners. It officially postponed elections and expanded testing capacity to 38 country-wide laboratories. But even as we and other countries took public health measures, worked to boost the availability of infection prevention and control commodities, including masks, gloves, and scaled cascaded training for healthcare workers on how to reduce a risk of COVID-19 transmission. And COVID-19 has, taken a toll on healthcare workers, infecting too many in Ethiopians and beyond. So as of 24 January 2021, more than 2,417 healthcare workers get infected due to COVID-19 in our country. So in a world that's already facing a dramatic shortage of healthcare workers, the World Health Organization estimates an additional 18 million healthcare workers will be needed in the next decade. So failing to protect them weakens our healthcare system and moves us away from the goal of universal healthcare and broader vision outlined in United Nations SDG 3 to ensure healthy lives and promote well-being for all at all ages. Sadly, these phenomena are not new or unique to the COVID-19 pandemic. Many outbreaks have taken an unacceptable toll on the health and well-being of healthcare workers. Healthcare workers' infections threaten the control of outbreaks by sidelining necessary workforce and impeding the regular provision of routine care. We know what to do. We must work to implement basic protocols for preventing and controlling infections in healthcare settings, and to ensure that water sanitation and hygiene standards are met in health facilities of every level. We must provide training and psychosocial support, measure progress that is made and commit to making further progress in the future. And we need to see, financing programs to support the healthcare workers as an investment case, which the cost of, inaction far exceeds. Better investment in our frontline defense against disease, threats will save lives and millions of, dollars during the next epidemic. Protect our commodities and safeguard our enemies. It is time to move from placing individuals to undue risk of accepting collective responsibility and accountability for the well-being of our healthcare workers. We can't afford to lose, one more healthcare worker. So government, donors, World Health Organizations, and all stakeholders must collaborate and act now to protect healthcare workers. The government of Ethiopia, in cooperation with all other member states, in all other stakeholders, is at the forefront to move this agenda to the next steps. So thank you for your attention, and thank you so much.
Okay, thank you so much, Sergey. Thank you for your presentation. Thank you for keeping to time. Thank you for the lessons you've shared from Ethiopia. And I think most importantly, we're grateful to the government of Ethiopia for the kind of leadership they have shown. There's no doubt about that, to me, a summary of what you've said really is that no health worker should die while trying to save life. That is a misnomer, that is an inequity, and that is something that we hope that from our discussions here today, as well as the very important report that was produced by Resolve to Save Lives and Partners, we'll be able to mitigate against this going forward, because this won't be the last pandemic. And moreover, across the African continent, several epidemics are happening at the same time, and health workers are also affected in those epidemics. So let me quickly introduce the panelists, for the panel discussion. It's my privilege to moderate this panel discussion. So the first panelist is Margaret Odera, who is a community health worker and mentor mother at Mathare North Health Center, located in a neighborhood in Nairobi, Kenya. Ms. Odera spends her days mentoring HIV-positive mothers and monitoring their progress to ensure there is no transmission of HIV from mother to child until the baby reaches 18 months old and is HIV-free. As an HIV-positive woman with an HIV-negative husband and 3 HIV-negative sons, Ms. Odera serves as a role model for how women living with HIV can thrive with access to essential health services and education to ultimately lower their HIV transmission rate to 0. Ms. Odera is also a skilled advocate and pushes for changes in her community and at global forums to better protect and support frontline health workers. Margaret, can you just quickly say hi to the participants?
Oh, hello everyone. It's nice to be here. Yeah.
Okay. All right. Thank you so much, Margaret. Yeah. Awesome. So the second panelist is Annette Kennedy. She's the president of the International Council of Nurses, a federation of more than 130 national nurses associations representing the millions of nurses worldwide. Operated by nurses and leading nursing internationally, ICN works to ensure quality nursing care for all and sound health policies globally. Former Director of Professional Development with the Irish Nurses and Midwives Association organization, nursing and midwifery leader in Ireland for more than 20 years now. Thank you so much, Annette, for being part of this. Can you say hi to the audience
hi.
too? All right, thank you so much, Annette. The last panelist, and definitely not the least, is Amanda Mcclelland. She has more than 15 years experience in international public health management. Amanda previously served as Global Emergency Health Advisor for the International Federation of Red Crescent, where she focused on emergency health, epidemic control, mass casualty in low resource settings, disease prevention and response operations. Amanda earned her Master of Public Health and Tropical Medicine from James Cook University in Queensland, Australia, and her Bachelor of Nursing from Queensland University of Technology. In her capacity as Senior Vice President of the Prevent Epidemics team, Amanda will lead the prioritization and planning of interventions/support in identified countries and regions to strengthen the action packages in prevention, detection, and response to epidemics. Amanda, a quick hi to our audience.
Hi, thank you so much, and thank you to all the panelists for joining us.
Okay, thank you so much, Amanda. So let me just remind the panelists that I have 3 questions for each panelist. And I'm expecting that each panelist is going to spend 1 minute per question so that we have time to round up before we go to Q&A. So the first question is for Margaret. Margaret, could you describe for us the situation where you work and the need for infection prevention and control.
Margaret, you need to unmute.
Okay, you have to unmute your microphone.
All right, thank you very much.
Okay.
Access to wash and IPC is very important to me as a community health worker and a mother living with HIV. Safety is a big issue for women I work for and myself because we are immunocompromised. COVID-19 has drastically affected access to wash and IPC in my health center, and there is need for immediate improvement. We had a shortage of PPE on and off since the beginning of the pandemic. The doctors are given the first priorities and the nurses, and since they are still complaining of poor working conditions, you can imagine what a community health worker is passing through. There is currently no sanitizer in our facility. The last bottle of sanitizer I was given was in November. And when I go to the houses, I have to buy myself a bottle of sanitizer, which is not sustainable for me as a community health worker. And then facility often lack disinfectants, the spray and fumigants. So, and I also serve as a community assistant. So it is very important for me to have this, the fumigants and disinfectants in my hand, so that to avoid infection and cross-contamination from me to my family, from me to the doctors and nurses. Thank you so much.
Okay, thank you so much, Margaret. I don't know. I'm sorry about the kind of situation, the condition that you find yourself, and I hope that part of this meeting, outcome of this meeting, as well as from that report, would at least push government and other partners to make sure that health workers are protected. So the second question is to Annette. So Annette, the International Council of Nurses co-signed with Resolve to Save Lives a report on protecting healthcare workers. What did you recommend governments need to do to mitigate the impact of COVID-19 on health workers and nurses? And what systemic changes are needed to avoid a similar situation come the next outbreak?
Thank you, and it's a great pleasure to work with Resolve to Save Lives. First of all, let me put it in perspective, because I don't think that governments realize the tsunami that's coming down the tracks, and it's not COVID. We will deal with COVID, and COVID will be over with the vaccine. But what we're not doing is looking at the shortage of healthcare workers. We have seen that 6 million nurses we will be short. 4.5 million will retire in the next few years, particularly in North America and in Europe. Tied to that, from our research, we have seen that a lot of nurses plan to get out of nursing because of what has happened during COVID. There has been no protection for them. They have been sent in to deal with a virus, a deadly virus, without the appropriate equipment, without the appropriate training, and without the appropriate support. Nobody would expect any health professionals to do that. It's not as if we don't know from previous epidemics what has happened. High percentage of nurses and healthcare workers have died in Ebola, in MERS, in all of the other epidemics. And consequently, we see that in our research, 2,200 nurses have died in 59 countries. We know that between 8 and 10% of nurses are infected, or healthcare workers are infected. If you're talking about 80 to 90 million, you're talking about millions of nurses being infected, as 60% of the workers, of all the health workers. That is a huge number. How are we going to see that we will have a universal healthcare, that we will have any healthcare system, if half the population of nurses will be depleted after this epidemic? So I think governments have to take it on notice. I don't think they have recognized what's happening. I don't think that they are preparing. You can prepare for a pandemic. You can prepare for seeing the end of the pandemic. But what we are not seeing is any preparation to retain the nurses and other healthcare workers? Are we not seeing any preparation to invest in the future, in training, and, you know, making sure that every country has sufficient healthcare workers? That's what's needed, and that's what's needed badly, besides all of the that are in the report.
Okay, thank you so much, Annette. So what I hear you say is that going forward, part of any epidemic preparedness plans must include preparations for health workers, engaging health workers, retaining them, ensuring that they are protected to protect us. And thank you for that. So Amanda, my first question to you is, what would you say to decision makers to make them care about protecting healthcare workers? What do they need to learn from this pandemic?
Yeah, thank you so much. And I mean, as a nurse, I take this issue quite personally. And I think part of the thing that is difficult to understand is the question that you asked me: how do we make decision makers care? And it seems like it shouldn't even be a question. Annette laid out the absolute numbers. Margaret laid out the risk at individual level. But we wouldn't expect firefighters to go into a fire without equipment. We wouldn't expect soldiers to go to war without equipment. Yet we expect healthcare workers every day to turn up to save lives, not just protected physically with the infection prevention and control measures, but mentally and emotionally. We're really seeing the drain on all healthcare workers as they battle huge numbers in intensive care, very difficult conditions. And as Margaret said, this ongoing risk when you go home that you potentially bring this virus home to your family, and the stress that puts on healthcare workers. So, you know, what would I say to decision makers? I think this is a duty of care. This is not just, you know, how do we make you care about this? You have to care about this. It's basic duty of care. But to speak dollars and cents, this is an investment. Investing in and protecting in healthcare workers is an investment that saves lives, builds workforces. As Annette said, we're missing millions of healthcare workers as we go forward. And we've seen the absolute economic impact of pandemics and epidemics. So I guess my main message to decision makers as I meet them and donors and governments over the last 5 to 6 years has been invest in healthcare workers, invest in their training, invest in their protection and their support for economic return, not just in terms of healthcare, but in raw economic terms.
Okay, thank you, Amanda. I think it's really very important to articulate the messaging to policymakers, because I mean the needs are infinite, resources are limited, so probably calls for making business cases for investing in health workers, making even political cases, because whatever it is that appeals to that particular health worker. But there's no doubt that it is imperative. We cannot continue like this, where people who are supposed to protect us are left, to die because they are simply trying to do their work. So Amanda, I'll still stick with you, for the next question. So what actions do international institutions and donors need to take to protect healthcare workers?
Look, I think there's some basics. The fact that 50% of healthcare facilities don't have water and sanitation, like Margaret said, not even water at the clinic, is critical. And we know that the construction of health facilities often come from big institutions like the World Bank. So we need to put pressure on those big donors. We don't build health facilities without the basics, water and sanitation, waste management and other issues. I think that's going to be critical. I think as we fund and support the training of healthcare workers, that has to go long term. It's not a one and done. We have to maintain in-service training for healthcare workers. We have to make sure that the provision of PPE and IPC provisions is part of every package when we're doing pandemic preparedness. And those things that make PPE work, like supply chain, that often get left behind and not invested in. Even if we have PPE, or as we're seeing with vaccine, it's hard to get to where we need it. So we need to think of the whole value chain that we require to protect healthcare workers, from investing in training all the way through to supply, innovative design of PPE and supplies, and then accountability on delivery, and really making sure that not just national associations and support from places like the ICN, but WHO are calling for more accountability of governments to record and document when they get healthcare worker infections, and more importantly, what are they doing to reduce those?
Okay, thank you so much, Amanda. And I think you know there was a statement you made earlier. I mean, how do you send soldiers into battle without the equipment for them to, to fight and protect, protect themselves, but most importantly, protect the nation that they're representing. Thank you so much for that. So, Margaret, I'll go back to you. In your place of work, what has been the impact of the pandemic on health workers? How has this affected the delivery of healthcare? Using your own personal experience where you work.
Okay, in Kenya, at least 41 doctors and 20 nurses have died of COVID. And I've personally been really scared of contracting COVID-19. Thank God I have not gotten it up to now. But as I speak right now, nurse and clinical officers are on strike, and they are demonstrating at the Capitol today. They have been on strike since December 9th. They're demanding on improved IPC, poor working conditions. They are very few in number, so they need an increase. Then they want the risk allowance, and it really has been this, because of the strike, the healthcare system has been paralyzed. It's crippled actually. And that means that women cannot deliver their babies in the health center. I talk to them at the gate and tell them to go to the private clinics to go and give birth there. But because of the money, to give birth in Kenya, private hospital is US dollars. So they opt to go to the traditional birth attendants, and this is a real backward. It's a real backward, more especially for the HIV positive mother. This is backwardness. And it's really traumatizing to me and for my mothers who are pregnant and they're expecting to give birth to HIV negative babies. It is really an issue, because we just pray that these babies will be delivered safely and will be HIV free in the long run. Then last week on the road, I met a 75-year-old woman. She was asking me, immediately we just got from this place, and this woman was asking me when she's going to get her drugs, because she missed her drugs for a week and she's hypertensive. So I just told this lady, let's meet today during the day and see what happens. So fortunately enough, she came, and I spoke to a clinical officer who works for the USAID, and she got her drugs, and I'm very glad for that. And then I have helped 2 mothers to deliver their babies on the road on my way to home visits. One mother was in a 4S street, and then the other mother was just at the gate of the hospital. And since the nurses were not there, and the baby had really, there was no turning back, I had to do what I knew best, me and my 2 fellow community health workers. And I'm glad the baby and the mother, they are safe. Thank you so much.
Okay, thank you so much, Margaret. Thank you for those very personal examples. I think they help to drive home the point. Sorry, Annette, you were raising your hand. Do you have a question?
Oh, no, sorry. Sorry, I was looking at the question. Apologies.
Oh. Okay, that's fine. So the next question is for you. So it's quite timely that you raised up your hand. So as a nurse, you know firsthand what it is like to face an epidemic without sufficient support. Based on ICN recently collected data, could you tell us about the impact of COVID-19 on nurses, in particular, the mental health of nurses, the impact of that, of COVID-19?
Yes, over the last year, we've been collecting a lot of data from our nursing associations. And as you said earlier, we have associations representing 27 million nurses. And what is coming from them is the actual physical and mental health. we have seen a deterioration over the 8-10 months. And it's extremely worrying now that between 20 and 80% of nurses are suffering from some kind of mental health issues, which can go from depression to burnout, to anxiety, to lack of sleep, to experiencing violence, experiencing people who don't want to wear masks or do anything to stop themselves from getting the virus. And that relates to the nurses. And I don't think people realize that going in, and I know that Margaret has said some of this, but going into hospital, worrying about whether you will contact the virus, whether you will bring it home to your families, whether you will infect somebody else, or indeed, if you have to stay with a patient who is dying, and these people haven't got, you know, nobody has told them that they're going in and that they're not going to get well, but you're using a telephone or using an iPad to connect with their families. Like, what kind of post-traumatic stress is this going to have on nurses in the long term? That worries me. You'll have post-traumatic, have post-COVID symptoms from the millions of nurses that have become infected, but you will have post-traumatic stress as well. And I don't think there's counseling, I don't think there's support, and I don't think there's recognition by health services or by governments or by anyone else to support these people. How do we expect to retain nurses in the workforce if we don't actually support them now? And I know that many nurses are tired of all the clapping and all the cheering and all the acknowledgements of governments, but without any action. There is no action. It's like as if, you know, you're not valuable to go in and work in a situation which is not acceptable, but you're not valuable when we talk about conditions of employment or pay or anything else.
Okay. All right. I mean, it's really sad because I think in as much as we're talking about responsibilities of government, policymakers, international donors, I think individuals also have a responsibility for at least doing the right things, wearing your mask, social distancing, making sure that you wash your hands as frequently as possible, because that alone reduces the burden of care that health workers have to provide, while we expect that government and policymakers also have to do, you know, to do this. Okay, so let me just let me take the last question to Amanda. So we know there will be a next time. What will it take to get to a different outcome for health workers the next time around? You know, quickly, so that we can now move to Q&A.
Yeah, and I see some great questions coming in. I think the issue is we can't wait for next time. We have to fix it now. There are healthcare workers infected and being infected. We don't have enough vaccine. The solidarity for vaccine for low-income countries has to prioritize healthcare workers, including community health workers like Margaret. We have to get down to the front lines and make sure that we protect all of our healthcare workers in the system all the way down. And so first and foremost, we have to focus on protecting healthcare workers now, and then we have to use that momentum. Doctors and nurses, healthcare workers shouldn't have to strike. The choice between saving your patients and saving yourselves is an extremely difficult one. And the fact that the Kenyan doctors and nurses have taken those steps means that we failed, not just in Kenya, but across the globe. This is an issue for us in the north as well. And so collective action and pressure on the World Health Organization, on our own national associations, and on the governments as a whole has to start now.
Okay. Okay, thank you so much, Amanda. There's a question here for you. Impact of COVID-19 thus far among health workers in Ethiopia, and where does the Ethiopian government stand compared to other countries? I say it.
Thank you so much.
Yeah.
Thank you for the question. As the question reflected, the COVID-19 actually has lots of impacts on our healthcare workers, especially in, you know, the emotional exhaustion, which may lead to some medical errors, lack of empathy in treating patients, itself. Also, it's negative role in healthcare workers' productivity. Even, at some point in time, it will expose our healthcare professionals to some high turnover rates, and there are different issues are happening. So in Ethiopia, actually, as I tried to explain in my previous notes, we do have more than 2,417 healthcare workers are already infected with this virus, and the number is actually currently there are some decrements, but actually we didn't make a sort of analysis with some of the global trends, but the number is significant compared to the number of healthcare workers we have. Thank you.
Okay. Okay. Thank you so much, Asege. So Margaret, I think this question is for you. The deplorable conditions that most healthcare workers face has been the same even after the Ebola experience. What should we do to make politicians take responsibility? Okay, I think we lost.
All right.
Okay, go ahead.
Okay, thank you so much. More has to be done to address the current pandemic and to avoid future pandemics, to protect patients, health workers, and our families. A constant supply of PPEs for all health workers, from doctors, community health workers, and support staff, excluding none. Then enough sustainable cleaning equipment and detergents, disinfectants is very vital. Enhanced continuous training for health workers, including infection prevention staff who are cleaners, cooks, laundry workers, gardeners, and facility assistants. These are the people who come in direct contact with the patients, and then they come in direct contact with doctors. So to avoid this cross-contamination, I think there should be an enhanced continuous training for us. And to prioritize all frontline healthcare workers, including community health workers, to receive the vaccine. We have not received it in Kenya. We're waiting. And we've been told that all of us will receive the vaccine. So, and then to pay frontline health workers, including community health workers, fair wages, and recognize the good work that we are doing in the community and in the facility. This has all to be prioritized in normal times, not just in pandemic, so that we are ready when the next pandemic arrives. Thank you so much.
Yeah, thank you so much, Margaret. I think you made a very important point there. It has to be known. It's not something that we have to change to again when the next pandemic comes. And I'm very happy that you mentioned cleaners, hospitalists, because I think most of the time when people are discussing health workers, they tend to thank you again, Margaret. So Annette, this question is for you. Healthcare workers are torn between providing services to save lives and their safety. What is the universal message that can be shared with all stakeholders as far as this is concerned? Okay, Annette, your mic is on mute. Yeah.
I realized that. Thank you for that.
All right.
That's an interesting question because it's very difficult for healthcare workers. Their first duty of care is, of course, always to their patient. And the second duty of care is usually to their colleagues. And they don't like to let either down. But there has to be a responsibility by governments, by health service employers, to the people who are providing the service. And for me, that is a duty of care. Nurses and healthcare workers have a duty of care to the patient, but there's a duty of care to them as well. And that doesn't seem to be recognized by governments or by anybody else, that, we have to protect. How in God's name are we going to have, patients safety and patients looked after if we don't look after the people that are looking after them. And we see now already the number of nurses that have died, the number of healthcare workers that have died, the number that are out sick from COVID, and the number that are suffering psychological and mental health issues. When they look at themselves after it, how will they feel? You know, and you ask, what is, unfortunately, for most healthcare workers, particularly those in the front line, they will always put their patients first. Sometimes, you know, I think they have to think again about what is the best for both the patients and themselves. They cannot go in sick, they cannot go in with depression, with burnout, with actually being sick. That's not good for anybody, for their patients. The other thing I think is missing here, and I know that Amanda has spoken about it, and that is about collecting data. Collecting data and having that standardized across every country is so important to know whether the infection is going from the nurse or the healthcare worker to the patient, from the patient to the healthcare worker, or, you know, across the system, or how is it being? How are you going to stop all those infections in hospital if you don't start?
Okay, thank you so much, Annette. So obviously, you know, questions are pouring in, but this meeting was for 45 minutes and we should be rounding up now. Unfortunately, we can't answer all the questions now. So back to the panelists. Can you just take 30 seconds, you know, and give us your final statement? If final statement as in, what do you want people to take away as the major point from this meeting? Just 30 seconds each. I'll start from Margaret. Your mic is muted.
Okay, thank you so much. The major point that I can take across is that all health workers must be protected, from the doctors to the lowest, to the cleaners and the cooks, because that is a very big gap in Kenya. So when you think about the doctors, think about the cook, think about the facility assistant, and this cleaner, who is the major worker in infection prevention and control. Thank you so much.
Thank you, Margaret, for keeping it brief. Asegit, what's your final point? 30 seconds.
Thank you.
Sorry.
Yeah, thank you so much. I think my final, thoughts is Ethiopia is very much committed, to take this agenda forward in cooperation with other member states. So this is a time that we need to advocate for healthcare workers' protection. So I think every actor, be it health professional, donors, and every actor should cooperate, and we need to double our efforts, to protect our healthcare workers. Thank you so much.
Thank you, Asegit. Amanda?
Thank you so much. Look, I just want to really thank Ethiopian Ministry of Health for taking the lead on this. This requires governments to take action, and it requires collective effort from civil society and health partners to hold those governments to account. And so, this is almost a now or never. This is not a new problem. We've known this for a long time, since the plague, Ebola. If we didn't know better, Ebola pointed it out all too clearly to us. And we haven't used the momentum to make collective change. So I appreciate everything the Ethiopian government is doing. I call on other governments to join the Ethiopians and to make this a critical issue, and for the civil society and health partners on the call to really hold those governments to account. Data and accountability for action, I think, is going to be critical as we move forward.
All right. Thank you so much, Amanda. Annette, you have the final word.
Thank you. I agree with all the points made already, and I would echo what Amanda has said. We have to call and hold governments to account. We really do, and we have to speak up. I mean, we cannot be silent any longer. We have to use our voice, and if we don't use our voice, we are wrong too. We are not helping all our colleagues, and I agree with Margaret. It's not just the nurses, it's not just the doctors, it's the cleaners, it's the healthcare assistants, it's the community health workers, it's the porters, it's the people who are supplying things, it's everybody. But we all have a duty to speak up. And that's what I would say. We have to hold governments to account. If we don't, we're wrong too.
Thank you so much, Annette. Well put. To be honest, I think the panelists have spoken very eloquently about this topic, made very strong points for the protection of health workers. It's indeed an urgent action by not just member states, international partners, civil society, and I think it also needs a lot of international push from other governments. So for instance, President Biden, has signed some executive actions that is supposed to help, promote U.S. leadership within the space. But again, I think it's also silent on how health workers would be protected as a result. So we hope that some of these recommendations from this meeting would, and from the report, we get to President Biden so that we will generate the needed, global action and push for this. Thank you again for signing up to attend this meeting. Thank you for all your questions and your comments. Again, greetings from Abuja, Nigeria capital city. Thank you so much, and God bless everyone.
Thank you.
Thank you. Okay, bye everyone.